The pandemic after the pandemic, long COVID. The virus may now be seen to move throughout the body and persist in organs, the Washington Post reports. As a result, long-term care will continue to be a significant issue for patients and the healthcare system. In addition, the entire world will need to get ready for a legacy of chronic illness victims. It is yet unknown how many people have long-term conditions, why they have them, and what chances they have of recovering, let alone what the long-term effects will be on society. In August, the U.S. authorities stated that no laboratory test can definitively distinguish long-term disease from other illnesses. Long COVID, also known as post-acute sequelae of COVID-19, is a group of symptoms that persist 3 months or longer after the initial illness and can include fatigue, shortness of breath, cognitive dysfunction, pain, difficulty sleeping, a racing heartbeat, gastrointestinal problems, and other conditions that make it difficult to go about daily activities. The virus can infect and replicate in the human brain by crossing the blood-brain barrier and spreading throughout the body. Still, the researchers also discovered that it appears to reserve most of its harm for the respiratory system. But, according to a study published in Nature in January, long-lasting effects can manifest in the heart, lungs, immunological system, pancreas, gastrointestinal tract, neurological system, kidneys, spleen, liver, blood vessels, and reproductive system. In addition, the endothelial cells that line blood vessels may also sustain long-term damage from COVID, which could explain why some patients experience symptoms. 3 million Americans may not be working because of long commutes. That equates to $168 billion in lost annual wages and 1.8% of the civilian labor population in the United States. In a September research, the National Bureau of Economic Research discovered that during the epidemic, 10 workers out of every 1,000 missed an entire week of work due to personal health issues, compared to 6 during an average week in the years prior. According to that study, COVID cost the U.S. $62 billion annually, resulting in a 500,000 person reduction in the labor force. A conservative estimate states that 65 million people, or 10% of the 651 million documented cases of COVID, may have long COVID. The workplace, economy, and healthcare could all undergo significant upheaval as a result. However, there are many unanswered questions, such as whether the extended COVID will cause a tsunami of disability claims from workers who discover they no longer have the strength or good health they did before the epidemic. In addition, long-term care insurance is now recognized as a disability under the Americans with Disabilities Act by the Department of Health and Human Services. Recognizing the impending crise's gravity and creating plans to deal with it are now priorities. A group of healthcare organizations called the COVID-19 Patient Recovery Alliance produced a promising list of recommendations for Congress and the administration in 2021 to 2022, with a focus on gathering more information about who is affected by long-term COVID and developing tools and strategies to aid healthcare systems, clinicians, and carers in responding. It's time to get everyone involved. The National Institutes of Health ought to take the initiative by designating a top person to advance long COVID research in all domains. The country and the rest of the world must get ready for what appears to be the pandemic after the pandemic.